helping make your life easier. Moms Every Day.
Welcome to momseveryday.com. I'm your host, Jen Lennon. Today I'm joined by Dr. Andrew Hall. He is from the Studio for Exceptional Dentistry. Dr. Hall, welcome back.
Good morning. Thanks for having me.
It's great to have you here. And today, Dr. Hall, we're going to talk a little bit, I know, about a lot of the questions or perhaps myths that you deal with surrounding children and their teeth.
Exactly.
So let's start at the beginning. Let's start with the pacifier. Pacifier, a good idea, bad idea? Tell us the truth.
It's a fine idea and
Okay.
a limited use.
All right.
So the key is to, one, the type of pacifier. So we just want to make sure that parents are buying an orthodontic or a nuke in UK type of pacifier.
Okay, those are specially designed.
Specially designed just to allow the upper teeth and lower teeth when the pacifier's in the mouth to be in a little better alignment. The second thing is we just want to try to see that behavior curbed by about the age of 4.
All right, so like you said, limited use.
Right.
It's okay as long as you're judicious about it. Now let's move on to the bottle. Obviously lots of babies use bottles. When does it become an issue in terms of dentistry?
The main thing is the behavior we see is parents putting their children to sleep at night with a bottle with milk inside of it. And people don't think about it, but milk actually has a lot of sugar inside of it. And
Right.
so basically you're bathing that child's teeth in sugar all night long by allowing them to do that. Now we understand sleep is important and it's a kind of a soothing effect, but it's not the greatest idea for the parents to have that behavior.
Okay, all right. So as long as you watch what you're doing with that and don't bathe it all the time. And then moving on to cleaning teeth, and actually when is it time to see a dentist? I know this surprised me a little bit. What's the recommendation?
The recommendation is for a child to see a tooth either when their first tooth actually erupts, their first baby tooth, or no later than the age of 1. And
That's earlier than I guess I would have guessed.
right.
Yeah.
Well, and it's just really to establish good behavior, good good experience in the dental office, a comfortable environment, so that we can hopefully set them up for success as an adult in the dental office as well.
And those habits, I guess that's truly what is important when you're dealing with a toddler or a child and dental health. Because even the cleaning, some parents think, well, I might not have to clean these baby teeth because they're not important. That's not true, right?
No, it's very important to take care of the baby teeth just like we do adult teeth. Baby teeth are susceptible to everything adult teeth are. So they can get decay, they can even get to the point of needing a root canal or abscessing like an adult tooth can. And the problem is that if we lose baby teeth prematurely, it can affect the adult teeth and the way the bite sets up and the alignment and the spacing and all of those things in the adult teeth.
So just assuming, it doesn't matter if this tooth decays or pulls out or anything like that, because really nature does have a plan for what the teeth are doing.
It does, and it's just very important that we take care of those baby teeth just like we would the adult teeth.
Right, and in doing so, is it important what products you use on your children's teeth or the type of toothbrushes?
Well, yeah, there are toothbrushes made specifically for infants, obviously, so a soft bristled small head toothbrush. And then it is important to use a toothpaste formulated just for a child. It is different than an adult's toothpaste.
So that's not just a marketing ploy, there really is a different formulation.
No, it is. It's basically for safety measures in case some of the toothpaste is swallowed by the child and that sort of thing.
Okay, and then finally, some protection that you can offer children and their teeth down the line, something called sealants. We may have heard this offered to us.
Right, usually about the age of 6 when their adult molars or back teeth are starting to erupt, we'll get to the point of maybe doing some preventative dentistry such as sealants. Basically all that is taking the grooves on the chewing surfaces of the teeth, sealing them over, which allows for them to be cleaned easier because that's where decay or cavities usually starts, is in that biting surfaces on the posterior teeth.
Great, well thank you for all those tips today. We really appreciate it, Dr. Hall. Now we know a lot more about our kids and their teeth. Thank you so much.
No problem.
And for more information about the Studio for Exceptional Dentistry, you can go to our website, momseveryday.com. Thank you for joining me today and every day. I'm your host, Jen Lennon, for momseveryday.com.
Visit Moms Every Day online or on the go through our Moms Every Day app. Download it today to find local solutions for you and your family.